Our family medicine program was founded in 1969. It's one of the oldest in the country, one of the largest in New York State, and has graduated over 500 residents. We offer a full spectrum, robust program that really caters to a diverse population and teaches you exactly what you need to do. Our program has a 100% board pass rate over the past several years. Having a 100% board pass rate kind of tells you how well-rounded and how prepared you are leaving this residency program. Within UB Family Medicine, we have 4 different training tracks. 2 are urban, 1 suburban, and 1 rural. They also have an outpatient continuity clinic and an affiliated hospital nearby.
When residents come to the clinic at Amherst, they can expect to find a very busy, very full, very well-organized clinical experience. We see all types of patients I had a 5-day-old infant to patients well into their 90s routinely come visit us. We take care of a variety of chronic issues like diabetes, hypertension, COPD, asthma, and we also have a number of acute visits available.
And the biggest thing for me also is the ability to form relationships with people over time, longitudinally. You meet somebody at their initial visit, and then you can see them consecutively going forward many, many times.
UBMD Amherst Clinic is just a mile or so away from Millard Fillmore Suburban Hospital. This is a community hospital where our residents receive their training. There are no other residents who are practicing at that hospital, so our residents really have a full experience there.
When I see people in the hospital, then weeks, months later, they see me again in the clinic and they remark about how they got such terrific care in the hospital or how we had helped them. Those positive differences that you make in people's lives, those are very impactful for me.
At ECMC, residents get, I think, amazing experiences in terms of taking care of the whole person, in terms of comprehensive care.
So I chose family medicine because I always wanted to be the doctor. I wanted to be the person someone could come to with whatever complaint, whether it be, high blood pressure, or if they're feeling anxious, down, depressed. I wanted to be someone that people could come to for anything, and be able to at least help them.
ECMC is in an underserved community in Buffalo. It's so important, I think, to have a family health center that's right in the middle of a community. There is so many opportunities to get involved with the community on different levels. We can go to health fairs and volunteer in different ways. Our clinic is attached to the hospital, which is nice. So when we have patients in the hospital, we can just walk on over there and see our patients. We really encourage continuity of care.
I feel very confident in my abilities in both in the outpatient world and inpatient world, and I like that.
And residents learn a lot about how to talk with patients, how to manage complicated patients, how to do procedures, and how to work with different professionals. It's an interprofessional group with the PAs, nurse practitioners, pharmacists, nurses, and that's been, I think, very gratifying too.
It's very cool to have everything right there and to be able to learn from all of these specialists and all the top doctors in their fields.
My hope for residents when they graduate from the UB and ECMC program is that they would be passionate about family medicine and just love what they do.
At the Jericho Road Community Health Center, we are located in the west side of Buffalo. This clinic was founded 20 years ago to serve the most vulnerable population of Buffalo, to make sure that they have access to healthcare.
So we have a lot of refugees. We have a lot of patients that don't speak English. We have a lot of high need patients, but we see a lot of full families. So we'll see the babies, we'll see the parents, we'll see the grandparents. A lot of our patients come from households that are multi-generational. So it's fun to take care of the whole family. We also do a lot of women's health and a lot of OB care.
At Jericho Road, we want to serve more than just their physical needs, but to treat the person as a whole. Services that include behavioral health, pharmacy, phlebotomy, ultrasound, and social services, including social work, care management, and ESL.
We see a lot of diseases that maybe aren't so common with people that are born here in the States. So we see, things that are more rare that maybe you didn't expect to see in residency.
Our residents work at Buffalo General Hospital. It's a large 500-bed urban hospital. As a second-year resident, you will be working with Jericho Road providers to deliver patients from our clinic, and you will be caring for them as the postpartum and also the newborns.
We have translators that are in person because about 50% or more of our patients, their first language is in English. So it's nice to have in-person interpreters. You get a much better story than on the phone. With being part of the community, you kind of see and find the areas where patients need the most help. So as their primary doctor, it's our role to figure out their treatment and then figure out how to make that treatment accessible to them.
For our program, the resident spends 8 months of their first year in Buffalo in a university setting. Then they relocate to Olean.
We work both at Olean General Hospital as well as at Universal Primary Care. It's a federally qualified health center. And so for our clinics, we really deal with a patient population that may not have access to any healthcare or have the funding or ability to pay for any healthcare.
So in our clinic, we take care of multiple different conditions: diabetes, COPD, CHF, multiple musculoskeletal conditions, obstetrics and gynecology, full spectrum family medicine care.
In a primary care outpatient setting, we really advocate for the patient as their pseudo-specialist as well. So if someone has a heart condition and cannot see their cardiologist for the next 6 months, we have to kind of step in and do at least the first little bit of assessment and evaluation.
Olean General Hospital is a 186-bed regional referral center. This hospital serves over 100,000 residents. Between New York and Pennsylvania's twin-tier region, we have a 24/7 staffed cardiac cath lab. We have a very busy emergency department and a very busy labor and delivery unit where we deliver over 800 babies yearly.
I really do like the fact that we can be in the hospital, in the emergency room, have our clinics, and the continuity of care therein. So it's a full spectrum type of medicine. We deal with all kinds of issues in the entire family unit. And for that reason, I really like to be well-rounded. I like to be kind of a generalist per se. UB Family Medicine really provides that opportunity.
Upon graduation, the residents go into a wide variety of different settings. They go into outpatient continuity care, some become hospitalists, urgent or emergent care, fellowships, as well as a lot for academic medicine. There's a few different concentrations within the program. First concentration is the Global Health Scholars Track.
The Global Health Track is a great opportunity for residents to go overseas and strengthen their physical exam skills. And then you learn a lot about culture. How do you live and work in different cultures and respecting others. We learn a lot from the patients and community leaders.
We also have an academic faculty development track, and in this track you can learn additional skills if you're interested in eventually practicing in academic medicine. You have a mentor, you have research opportunity, and protected teaching time as well.
The last concentration that we have, it is an obstetrics concentration, and it really focuses on sharpening and broadening the skills for residents to practice obstetrics upon graduation. We have a couple different community outreach programs. One of them is the Lighthouse Clinic, which is a medical student-run free clinic for the city of Buffalo. We offer something called UB Heals, which is a homeless outreach program, kind of a street medicine program.
The Primary Care Research Institute is a great resource for our residents and also faculty. They bring in researchers, clinicians, community partners to help support any research that you may be interested in completing during your residency.
Research is very important for the residents because you start to get more academic, and we need research in order to drive change through medicine.
And one of the things we try to teach residents is that it is really important to have that work-life balance. It's not just about medicine as a profession, it's about life. and life skills, and how do you be successful and be happy in your career and in your relationships.
My ideal family medicine resident is someone that shows up and comes to work ready to learn. No one's ever gonna perfect medicine, we practice it. And as long as you show up and ready to learn, we can certainly teach you the medicine you need.